6.
One of the world's first patients to be treated by a new drug that delays the onset of type 1 diabetes is getting that treatment right here in Columbus. WRBL's Hannah James files this exclusive report.
The fact of the matter is that, amazingly, the city of Columbus is farther ahead in dealing with this drug than any other place in the world.
That was Dr. Stephen Leichter, who administered the first ever human dose of insulin in 1982. Right now, he is on the doorstep of curing type 1 diabetes.
Type 1 is someone who has lost the cells in the pancreas that make insulin, the beta cells. So they have an absolute deficiency of insulin, and they have to take insulin to keep their blood sugars controlled.
For the last 3 years, Piedmont Endocrinology has been a part of clinical research for teplizumab. That's the generic medicine of TZIELD infusions.
It's a 14-day IV infusion, so you come back over successive days. And what this is designed to do is really pause the onset of type 1 diabetes in younger patients. So it's really cutting-edge medical technology that we're excited to be a part of.
Candidates for the drug must be in the process of getting type 1 diabetes.
This drug, if you can spot someone who's in the process of getting type 1 diabetes but hasn't completely gotten the disease, which means they're starting to kill their cells that make insulin, the beta cells, but they still have some left, we can infuse this drug into them, and it will stop the onset of the disease between 2.5 and 7 years.
But why is prolonging the onset of type 1 diabetes significant?
This is the first breakthrough treatment, and now, since scientists realize, hey, we can do this, they're trying to find all kinds of other approaches, or to see if this drug, simply if somebody starts to relapse, you just infuse this drug into them again, it'll further delay the onset of the disease.
15-year-old Ella Velez is one of the first patients in the world to receive this treatment. Her brother, Alex, was a part of the clinical trials. Ella was tested for autoantibodies after she was monitored for nearly 2 years before receiving her 14 transfusions.
This breakthrough for Columbus is much more meaningful than it seems. First of all, we were excited to be a part of the research for this drug. And to me, it's one of the greatest developments in my area of medicine and endocrinology in my entire career. It means that if we can identify people who are starting to develop type 1 diabetes, we can stop it.
That was Hannah James reporting. TZIELD is for people ages 8 and older who have stage 2 type 1 diabetes. Head to WRBL.com to learn how the Bill and Olivia Amos Children's Hospital will become among the first medical facilities in the country with the capability to offer this treatment. You're watching News 3 at 6. Bob will have your 7-day forecast in 2